Hi all, nice to see you again. I'm just going to talk here about liver problems and alcohol-related disease in general. Liver issues, especially, are called the silent killer because generally the symptoms don't show up until it's too late. So basically, if you have got any issues, then push for the doctor to do maybe a scan. I know it's not that easy to get a scan, but push it if you've got a problem, you're feeling unwell, because I used to go to these Wellman clinics once a year, routine tests, but that routine blood test won't show alcohol-related problems in a lot of cases, or at least in some cases. It will only show up on an imaging device, a US scan, ultrasound scan, that sort of thing. So basically, you can have issues with alcohol and nobody will be able to tell. Because as I said, the early symptoms are undetectable by sight anyway, or even by your general state of health, because people, especially when they're younger, can compensate for any symptoms that are caused. So you might feel fatigued, might have a bit of a cold, not eating too well, just a bit of weight. But people put that down to other factors. So basically, what I'm trying to say here is a blood test. A lot of people think, well, a full blood count will not, in some cases, show up the main problem, which is the alcohol issue. So push the GPs. I wish I had when I was younger, because I think I left it too late in a way. I mean, I'm fine now, but I know a lot of people who left it too late and aren't with us anymore. But check your doctor out first. I'm not a medic. I'm here to give advice. So if you've got any questions about anything, drop me a comment. I'm more for practical advice because I am an alcoholic. I've had a lot of issues with it. And I'm here to help people and grow a community of people to try and get off this poison, as it were, which it is, and have a better life, because there are no benefits to drinking alcohol, but you'll benefit hugely from being sober. And I did a video earlier about relapse. That's the biggest problem. It's not just getting sober. The biggest issue and the big fight for everybody who's got an alcohol problem is to stay sober. And stay sober long term. And in my case, stay sober for life. That's what you've got to do. And be aware of the triggers. But check with your doctor if you're doing this yearly thing and just ask. Maybe to do some other tests, especially if you're feeling unwell a little bit yourself. Nobody tells the doctor, in my experience, exactly what they're drinking. If you have 4 pints a day, you're telling me about 2 or 3 pints 2 or 3 times a week. I know people who drink 10 pints a day and tell the doctor they go a couple of times a week. The doctors can't diagnose things unless you tell them the facts. You know, they don't judge you on that because you drink a lot. They don't have a go at you. Oh, you shouldn't be drinking that much. They might mention it, but it's your health at the end of the day, isn't it? It's your family. It's your life. And I urge everybody just to push that issue. If you've got any questions, drop me a line. And if you enjoy the channel, then please subscribe. I'll speak to you all soon.